Hi, I'm Nate, and welcome to the channel. This year, the 19th of October is SUDEP Action Day, so we'll be talking about epilepsy and pregnancy. Please subscribe to the channel and give this video a like. Firstly, what is epilepsy? It's a neurological condition causing a person to have recurrent seizures, and although seizures can be caused by many things, an epileptic seizure originates from within the brain. It affects 1 in every 30 people in the UK, and most commonly starts in childhood. Epilepsy affects people differently, and the seizures one experiences are different from person to person. They can be classed as either generalized seizures, which affect the whole brain, for instance, a tonic-clonic seizure, an absence seizure, myoclonic seizure, tonic seizure, or atonic seizure, or they can be focal seizures which affect a specific part of the brain, like a simple focal seizure or a complex focal seizure. It is estimated that 1 out of 20 people will experience a seizure during their lifetime. Therefore, knowing what to do when witnessing a seizure can save a person's life. If you see a person is having a seizure, stay with them until the seizure ends. Check the time for when the seizure had started. If they are shaking their whole body or they're about to fall, ease them slowly to the ground. Turn them onto one side to allow them to keep breathing. Place something flat and soft like a jacket under their head, and remove glasses or ties they might be wearing which can cause them to struggle. Make sure that the surrounding area is clear of sharp or dangerous objects that can cause injuries. Do not try to pin the person down, as it's safer to allow them to continue with their uncontrolled movements. Once the seizure has stopped and they're starting to become alert, explain in simple terms what has happened, and offer to call their family or friends to help bring them home safely. Only offer food or drink once they're fully alert, and if the seizure lasts for longer than 5 minutes, request for an ambulance immediately. When it comes to having a baby, it's a common myth that people living with epilepsy will struggle to conceive. Nevertheless, we advise those who are not planning to have children soon to use effective contraception, as pregnancy can come with additional risks and will require additional care. Some hormonal contraceptive can interact with specific types of anti-epileptic medication, such as topiramate, phenytoin, or carbamazepine, and so will require a higher dose of the contraceptive to remain effective. And those who take lamotrigine whilst on some hormonal contraceptive may require a higher dose of lamotrigine in order to manage the epilepsy. If you're unsure, please speak to your doctor or neurologist who can clarify your medications and contraceptive needs. We advise those planning to conceive to speak with their neurologist and obstetrician so that everyone's prepared for the additional care required. When trying for a baby, it's important to take 5 mg of folic acid daily until 3 months into the pregnancy. This helps to minimize the risk of serious brain and spinal issue as the baby develops in the womb. Your neurologist will review your anti-epileptic medications. In some instances, they may advise changing the dose or type of medication, or they may agree to stop medicating entirely. They can also discuss the chances of the child developing epilepsy later on in life. If you have a positive pregnancy test, it's important that you continue with your medications and only stop them if advised by your doctor. About a third will experience an increase in the frequency of seizures during the pregnancy. This is likelier if they've had a seizure during the 9 months leading up to the pregnancy. Those with tonic-clonic seizures are at a higher risk of miscarriage, while there's no evidence that people with other forms of seizures being at a higher risk of harm. Epilepsy in itself does not increase the chance of the baby having structural deformity. However, the medications used to manage epilepsy can increase this risk. It's important to know that although the risk is higher for those taking medication, over 90% of babies will turn out absolutely normal. Not all medications will cause the same problem. Studies have shown that levetiracetam and lamotrigine are some of the safest anti-epileptic drugs, whereas those taking sodium valproate or require many different types of medications are at the highest risk. There is a link in the description which provides information on many different types of anti-epileptic drugs. One of the reasons we advise people not to stop their medications without professional counsel is because of the risk of SUDEP. SUDEP stands for sudden unexpected death in epilepsy and affects 1 in 1,000 people living with epilepsy. As the name implies, these deaths occur unexpectedly, with no cause identified. We're still not sure why this happens, but some think it might be due to an irregular heart rhythm during a seizure or breathing problems after a seizure. People at a higher risk of SUDEP are those with uncontrolled or poorly controlled epilepsy, especially those who do not take their medications. Therefore, we advise taking the prescribed medication at the same time of the day. Set up alarms and try to keep to a strict routine to minimize the risk. People with tonic-clonic seizures are also at a higher risk of SUDEP. SUDEP tends to happen at night, Therefore, we recommend those who experience seizures at night to take extra precautions, such as having a seizure alarm, making safe sleeping arrangements, as there's evidence that those sharing the same sleeping space with others are less likely to experience SUDEP, and consider safety pillows which have holes in them. People with epilepsy are also at a higher risk of death caused by accidents or drowning, suicides, and status epilepticus, which is when a seizure lasts for a long period of time, or when there are multiple seizures occurring without breaks of alertness. There's a high proportion of people with epilepsy suffering from mental health issues, and so if there's a change in your mental health, seek help as soon as possible. During the pregnancy, you will have regular appointments with both the midwives and obstetricians. It's important to avoid triggers for seizures like stress or sleep deprivation or pregnancy sickness, which can lead to dehydration or difficulties with taking medications. If you're struggling to keep food or medication down, speak to your doctor urgently. Your obstetrician or neurologist may consider performing regular blood tests to monitor the drug level to see if the dose of the medication is still appropriate for you. Due to the increased risk of structural problems, you will be offered a scan both in the first and second trimester. If there are additional concerns that your baby may not grow to their full potential, growth scans may be offered in the third trimester. We also recommend pregnant people with epilepsy to register with the UK Epilepsy and Pregnancy Register. There is a link in the description below. During labour, we recommend being at the consultant-led unit and avoid using the pool for most people with epilepsy. However, if a person has not had a seizure for over 10 years or has not been on medications for the last 5 years, a water birth or birthing in a midwifery-led unit can be considered. There are certain forms of medications, most notably pethidine, which we would advise against using in labour, as they lower the trigger threshold for a seizure. For people with a background of tonic-clonic seizures, 1 to 2% will experience a seizure during labour or within 24 hours after birth. A seizure during labour can cause oxygen shortage to both the mother and the baby. Therefore, we aim to stop the seizure quickly with a medication called benzodiazepine. This can be given through a drip line, as an injection, or as a suppository. We'd also recommend monitoring baby's heart rate continuously if there's a high risk of a seizure occurring or soon after a seizure. If there's any concern that the baby is in trouble, we may recommend delivering sooner. After birth, we'll support the mother with feeding. There's no evidence that breastfeeding whilst on medication causes any long-term problem to the child. We'd also offer a vitamin K injection for the baby, as this is important to help with blood clotting when necessary. The dose of the anti-epileptic medication may need to be readjusted, ideally following a discussion with the neurologist. Although baby blues is a very common phenomenon, people with epilepsy are at a higher risk of postnatal depression, so if you're feeling down, anxious, or have concerns about your ability to care for your child, speak to a healthcare professional, like your GP or midwife. When caring for the child, we advise that changing and feeding be done on the ground, avoid bathing the child alone, and avoid using baby slings. Set an alarm to help with taking medications, and share feeding responsibilities with your family, especially at night. Try meal prep so that there's food available whenever you feel hungry, as well as having food prepared for the baby in case you're unable to make it after a seizure. Although much of what we've talked about can sound daunting, rest assured that most pregnancies will turn out absolutely fine. Give this video a like if you found this helpful. Share, subscribe, and I'll see you again soon.